the future of Mississippi's healthcare system remains clouded as the governor's first State of the State address offers ideas and goals.
But those hopeful for a more robust solution to the current crisis says they're back to square one. 12 News senior political correspondent Gerald Harris has the story.
Indicated over 70% of voters are concerned about health care costs. The Millsap Chisholm Strategy Survey also finds 60% in favor of some kind of Medicaid expansion. Governor Tate Reeves is opposed to any kind of expansion, and in his State of the State, he addressed health care concerns, but did not offer a specific plan, instead offering ideas. The governor outlined a vision to bring more doctors into parts of the state where they're needed.
I believe that a major expansion of our rural physician scholarship program will help us get there. I believe we must invest in rural residency programs. I believe there should be incentives for businesses that contribute to hospitals in rural areas. I believe we should expand telemedicine to reduce the cost of care.
Governor Reeves' opposition to Medicaid is no secret. He ran on the issue, and it is no surprise to Senator Hobb Bryan, a Democrat who chairs the Public Health and Welfare Committee.
We had an election. The people overwhelmingly elected him governor. They voted not to have Medicaid expansion. Elections have consequences.
Senator Bryan argues Medicaid expansion is a worthwhile investment.
The state of Mississippi would make money off Medicaid expansion. We are losing money for the purpose of refusing to allow Medicaid expansion. There is no cost to the state.
Lieutenant Governor Delbert Hosemann has looked into the issue, but it's not clear if anything will happen this session. In the meantime, the Northeast Mississippi Democrat says part of his job will be to encourage people to access health care that's available.
Lay people with some training act out in all over the state to encourage people to have better lifestyles and to access what health care is available.
But for now, bold health care reforms are left in the air as rural hospitals struggle to stay open. Reporting at the Capitol, Gerald Harris, 12 News.